The emergency room doors burst open as paramedics rushed in with a man clutching his chest, his face contorted in pain. The heart monitor attached to him beeped erratically, each sound a warning of the crisis unfolding. Dr. Isaiah Reynolds was already there, his experienced hands ready to take over. 50-year-old male, severe chest pain radiating to the left arm, possible myocardial infarction. The paramedic rattled off as they transferred the patient to the ER bed. Dr. Reynolds moved forward with the confidence of a surgeon who had saved countless lives in his 15 years at Westlake Medical Center. "Sir, I'm Dr. Reynolds, cardiothoracic surgeon. We need to." The patient's eyes flew open, pain momentarily overcome by a different emotion. Richard Blackwell looked at Dr. Reynolds, his gaze traveling from the surgeon's dark skin to the name tag on his white coat. "No," Richard gasped between pained breaths. "Get me another doctor." Dr. Reynolds maintained his professional demeanor, thinking perhaps the patient hadn't heard him clearly through his pain. "Sir, you're experiencing a cardiac event. We need to act quickly, too." "I want a white doctor," Richard interrupted, his voice strained but deliberate. "Not you." The room fell silent for a heartbeat, the only sound the persistent beeping of the monitor. The nurses exchanged glances, the paramedic stiffened. Dr. Reynolds stood perfectly still, his expression unreadable as the weight of those words settled in the air around him. "We'd love to know where you're watching from. Drop a comment below with your city or country. It's amazing to see our community tuning in from all over the world." All right, back to our story. Just 4 hours earlier, that same morning had begun like any other for Dr. Isaiah Reynolds. The sun was barely creeping through his bedroom blinds when his alarm chimed at 5:15 a.m. Within minutes, he was lacing up his running shoes, a ritual that had seen him through medical school, residency, and now his position as one of the most respected cardiothoracic surgeons at Westlake Medical Center. 3 miles later, shower done, and dressed in a crisp blue shirt under his tailored suit, he prepared a protein smoothie in his kitchen. The walls of his apartment were adorned with framed diplomas and awards: Harvard Medical School, Johns Hopkins residency, Surgeon of the Year at Westlake for 2 years running. Achievements that had required twice the effort of many of his peers, though he rarely spoke of that reality. The drive to Westlake Medical Center took 15 minutes. The imposing brick and glass structure housed one of the nation's top cardiac care units, largely due to the innovative techniques Dr. Reynolds had helped implement. As he walked through the hospital corridors, he greeted colleagues with a warm smile and brief conversation. "Morning, Dr. Reynolds. Those valve replacement results from yesterday look promising," called Dr. Patel from the nurse's station. "Thanks, Anita. The new procedure is reducing recovery time by nearly 30%, he replied, his voice carrying the measured enthusiasm of someone who found genuine joy in medical advancement. His morning rounds were methodical and compassionate. For each patient, he took time to explain procedures, answer questions, and offer reassurance. When elderly Mrs. Kaplan gripped his hand and said, "You've got magic in these fingers, doctor," he smiled and gently told her, "No magic, Mrs. Kaplan, just science and a good team." By noon, he had completed his rounds and was reviewing charts when his pager buzzed. A consult was needed in cardiology for a new patient, Richard Blackwell, 50, presenting with severe chest pain and concerning EKG changes. Dr. Reynolds made his way to the cardiology department, reviewing Blackwell's preliminary information on his tablet. The patient had a history of hypertension, was overweight, and had a family history of heart disease, a textbook candidate for coronary complications. What the chart couldn't show, was the kind of man Richard Blackwell was. The kind who'd grown up in a small town where diversity was something seen on television, not in his neighborhood. The kind who'd inherited not just his father's construction business, but also his views on who belonged where in the world. The kind who had never had a black doctor and never imagined he would. When Dr. Reynolds entered the examination room, Richard was sitting upright on the edge of the bed, one hand still rubbing his chest despite the medication he'd been given in the ER. "Mr. Blackwell, I'm Dr. Reynolds, cardiothoracic surgeon. I understand you've been experiencing chest pain." Richard looked up, his discomfort momentarily displaced by surprise. His eyes narrowed almost imperceptibly. Yeah, he said curtly. Started this morning. Feels like someone's sitting on my chest. Dr. Reynolds nodded, maintaining his professional demeanor as he began his examination. Any pain radiating to your arm or jaw? Shortness of breath? Nausea? Richard answered the questions minimally, his body language stiff. When Dr. Reynolds placed the stethoscope on his chest, Richard flinched slightly. Your EKG shows some concerning changes, Dr. Reynolds explained, pulling up the results on a screen. Given your symptoms and history, I'm recommending we perform an angiogram to get a better look at your heart's blood vessels. Richard shifted uncomfortably. Isn't there someone else who could do it? Like, Dr. Parker? I've heard he's good. Dr. Reynolds paused, recognizing the request for what it was. Dr. Parker is an excellent cardiologist, but he's currently away at a conference. I assure you, I've performed hundreds of these procedures with excellent outcomes. Richard's jaw tightened. I prefer to wait for someone else. Dr. Reynolds had encountered this before. Patients who didn't say it outright, but made it clear his skin color made them uncomfortable. 15 years of practicing medicine, of saving lives, of being at the top of his field, and still, these moments came. Mr. Blackwell, your condition appears to be urgent. Waiting could potentially worsen your prognosis. The angiogram will tell us if you need immediate intervention. Look, Richard said, sitting up straighter despite the pain it clearly caused him. No offense, but I just feel more comfortable with someone else. The unspoken word hung in the air, white. Dr. Reynolds nodded once, his face a careful mask of professionalism that had been perfected over years of similar encounters. I'll consult with my colleague, Dr. Sharma, to see if she's available. As he left the room, Dr. Reynolds felt a familiar weight on his shoulders, the additional burden of excellence under scrutiny. Behind him, Richard Blackwell's condition was already deteriorating faster than anyone realized. As a child, Isaiah Reynolds had discovered a book about the heart in his elementary school library. He'd been fascinated by the diagrams, by the idea that this fist-sized organ pumped life through the entire body. I'm going to fix hearts one day, he'd told his mother, who'd smiled and said, You've already got the most important qualification. You've got a good one yourself. The journey from that library to Harvard Medical School had been lined with excellence and obstacles in equal measure. The memory of his third year of medical school surfaced now as he walked away from Richard Blackwell's room. It had been during his surgical rotation. He'd prepared meticulously for each procedure, studied longer, practiced more, knowing the unspoken truth. He would need to be twice as good to be considered half as capable. Reynolds explained the bypass procedure to the group. His supervisor had demanded unexpectedly during rounds. Isaiah had detailed the procedure flawlessly, down to potential complications and recovery protocols. The supervisor had nodded, then turned to a white student. Thompson, anything to add? Thompson had fumbled through an answer with half the detail Isaiah had provided. Good, the supervisor had said. You'll assist in this afternoon's surgery. Later that day, Isaiah had found himself observing from the back of the gallery while Thompson, who had barely passed the last exam, stood at the operating table. That night, his roommate had said, That was messed up, man. You deserve that spot. Isaiah had only shrugged. Then I'll deserve it so loudly next time that they can't ignore me. And he had. He'd graduated top of his class, earned fellowships others coveted, published research that changed protocols. When he finally stood at that operating table, his hands steady as they held a human heart, he knew he belonged there, even if others still questioned it. Now, 15 years into his career at Westlake, Dr. Reynolds sought out Dr. Sharma, explaining the situation without mentioning the undercurrent of prejudice. The patient is requesting another physician for his angiogram. Are you available this afternoon? Dr. Sharma glanced up from her computer, her eyes knowing. Another one of those, huh? I'm scheduled for procedures until 5, but I could squeeze him in after. His EKG suggests we shouldn't wait that long, Dr. Reynolds replied. Dr. Sharma sighed. I'll see what I can rearrange, but... Their conversation was interrupted by the urgent sound of a code blue alarm. Both doctors turned toward the source, Richard Blackwell's room. They rushed down the hallway to find nurses already performing CPR on Richard, whose face had turned an alarming shade of gray. The monitor showed the erratic pattern of ventricular fibrillation. Crash cart, Dr. Reynolds called out, immediately taking charge of the situation. Charge to 200 joules. As the defibrillator charged, he positioned the paddles on Richard's chest. Clear. Richard's body jerked with the shock. The monitor continued to show VFib. Charge to 300. Push 1 of AP. Another shock. Still VFib. Begin CPR again. We need to get him to the cath lab now. As the team worked frantically to stabilize Richard enough for transport, Dr. Reynolds knew what the symptoms suggested: a massive myocardial infarction, likely with a complete blockage. Minutes mattered now. The longer the heart muscle went without oxygen, the more damage occurred. The irony wasn't lost on him. The man who had rejected him based on skin color now had his life in Dr. Reynolds' hands. But in that moment, Dr. Reynolds saw only a patient, a heart in crisis, a life to save. The team rushed Richard down the hallway toward the catheterization laboratory, where Dr. Reynolds would attempt to open the blocked artery. As they pushed through the doors, Richard briefly regained consciousness, his eyes fluttering open to see Dr. Reynolds above him. Recognition and panic flashed across Richard's face. With what little strength he had, he gasped, "Not you." Dr. Reynolds leaned closer, his voice calm but firm. "Mr. Blackwell, you're having a heart attack. I'm going to save your life. Right now, I'm the best chance you've got." Their eyes locked for a moment before Richard slipped back into unconsciousness. The cardiac monitor began to wail again as his heart rhythm deteriorated further. Dr. Reynolds looked up at his team, his decision made. "Let's move. Every second counts." The catheterization laboratory at Westlake Medical Center was a symphony of technology and expertise. Monitors beeped, machines hummed, and medical staff moved with practiced precision as they prepared for the emergency procedure. Dr. Reynolds stood at the center of this controlled chaos, already gowned and gloved, his mind focused entirely on the task before him. As Richard Blackwell was transferred to the procedure table, the hospital administrator, Patricia Winters, stepped into the lab. Her face was tense with concern. "Dr. Reynolds, a word," she said, motioning him to step aside. Time was precious, but Dr. Reynolds knew hospital protocols had to be addressed. He moved to the corner of the room while his team continued preparations. "The patient explicitly refused your care," Patricia said in a low voice. "His family has been notified of the emergency, but from a legal standpoint, he's unconscious, in full cardiac arrest, and minutes from death," Dr. Reynolds interrupted, his voice calm but firm. "Emergency doctrine applies. We don't have time to wait for another surgeon to arrive, and Dr. Sharma is in the middle of another procedure." Patricia nodded, understanding the reality of the situation. "I'll handle the paperwork and any fallout. Save his life, doctor." Dr. Reynolds returned to the table where Richard lay, now intubated and connected to a ventilator. The cardiac monitor continued to show dangerous arrhythmia despite the medications being administered. "Fluoroscopy ready," announced the technician. "Let's begin," Dr. Reynolds said, his voice taking on the steady, focused quality his team recognized from countless procedures. Femoral access. As he worked to thread the catheter through Richard's femoral artery and up toward his heart, Dr. Reynolds' mind remained singularly focused. Years of training had taught him to shut out everything but the task at hand. The prejudice, the irony, even the potential legal complications faded away. There was only the path to the heart, the blockage to clear, the life to save. The fluoroscopy screen revealed what Dr. Reynolds had suspected: a complete occlusion of the left anterior descending artery, often called the widowmaker for its lethal potential when blocked. 100% occlusion of the LAD, he announced to the team. "We'll need to place a stent immediately." As he maneuvered the guide wire through the blockage, a particularly challenging task given the severity of the occlusion, Dr. Reynolds thought briefly of his father. Harold Reynolds had been a mechanic, his hands always stained with engine grease, his problem-solving skills legendary in their neighborhood. "The tools might change, son," he'd once told Isaiah, "but the principle's the same. Find what's broken and fix it with whatever you've got. Right now, what Dr. Reynolds had was advanced medical technology, years of specialized training, and seconds ticking away as he worked to restore blood flow to Richard Blackwell's dying heart muscle. "Balloon catheter," he requested, and a nurse placed it in his outstretched hand without delay. He positioned the balloon at the site of the blockage and inflated it, compressing the plaque against the arterial walls. The tension in the room was palpable as everyone watched the monitor, waiting to see if blood flow would be restored. "Pressure's holding," the assistant reported. "Balloon's stable." Dr. Reynolds nodded, his focus unwavering, preparing to deploy stent. Just as he was positioning the stent, Richard's body suddenly jerked, and the cardiac monitor emitted a harsh, continuous tone. Ventricular fibrillation had returned. "He's crashing again." Starting CPR, called out the assisting nurse, beginning chest compressions. "Continue the procedure," Dr. Reynolds directed calmly. "We need to get this vessel open now." Working with practiced efficiency despite the chaos around him, Dr. Reynolds deployed the stent while the rest of the team fought to keep Richard alive. It was a delicate balance. The compressions made the precision work more difficult, but without them, Richard would die before the stent could even matter. "Stent deployed," Dr. Reynolds announced. "Let's reassess rhythm." The team paused CPR momentarily to check the monitor. Still VFib. Resume compressions. "Charged to 360 joules," Dr. Reynolds ordered. The defibrillator whined as it charged. "Clear." Richard's body arched with the powerful shock. All eyes turned to the monitor. For 3 agonizing seconds, nothing. Then, a beep. Another. The erratic pattern gradually organized into something closer to a normal rhythm. "We have sinus rhythm," the nurse announced, the relief in her voice unmistakable. "Blood pressure's coming up," added another staff member. 70/40ths. 80/50ths. Dr. Reynolds examined the fluoroscopy screen, confirming that blood was now flowing through the previously blocked artery. "Good flow through the LAD. The stent is holding." For the first time since rushing into the cath lab, Dr. Reynolds allowed himself a deep breath. Richard Blackwell wasn't out of danger. The damage to his heart muscle could be extensive, and recovery would be challenging, but he was alive. The immediate crisis had passed. As the team prepared to transfer Richard to the cardiac intensive care unit, Dr. Reynolds looked down at the unconscious man's face. What would Richard think when he woke up and learned who had saved his life? Would it change anything? Or would the prejudice remain, just hidden beneath a veneer of obligatory gratitude? Dr. Reynolds had seen both outcomes in his career. Some patients had their worldviews transformed by such experiences. Others found ways to maintain their biases despite the evidence before them. Either way, his job remained the same: to heal, regardless of who the patient was or what they believed. "Let's get him to SICU," he directed. "I want continuous monitoring and updates every 30 minutes. The next 12 hours were critical. Dr. Reynolds checked on Richard frequently between his other responsibilities, monitoring lab values, adjusting medications, and watching for signs of complications. The damage assessment showed that while significant heart muscle had been affected, the quick intervention had salvaged more than initially hoped. It was nearly midnight when Richard began to regain consciousness. Dr. Reynolds was at his bedside, reviewing the latest echocardiogram results, when he noticed the flutter of eyelids. "Mr. Blackwell," he said quietly, "can you hear me?" Richard's eyes opened slowly, confusion evident as he tried to make sense of his surroundings, the beeping monitors, the 4 lines, the oxygen mask over his face. His gaze finally settled on Dr. Reynolds. Recognition dawned gradually, followed by what appeared to be disorientation. He tried to speak, but couldn't around the breathing tube that had remained in place. "Don't try to talk," Dr. Reynolds instructed. "You've had a severe heart attack. You're in the cardiac intensive care unit at Westlake. The breathing tube is helping you right now, but we'll evaluate removing it in the morning if your oxygen levels continue to improve." Richard's eyes remained fixed on Dr. Reynolds, questions evident in them. "You had a complete blockage in one of your main coronary arteries," Dr. Reynolds explained, his tone professional but not cold. I performed an emergency angioplasty and placed a stent to open the vessel. We were able to restore blood flow, but your heart has sustained damage. You'll need significant recovery time." Richard's hand moved slightly, and Dr. Reynolds realized he was trying to communicate. He handed Richard a small whiteboard kept nearby for intubated patients. With a shaky hand, Richard wrote, "You did surgery?" Dr. Reynolds nodded. "Yes. By the time you went into full cardiac arrest, there wasn't time to find another surgeon. It was an emergency situation." Richard stared at him for a long moment, then wrote again, "Did you have to save me?" The question caught Dr. Reynolds off guard. It wasn't gratitude, but it wasn't quite accusation either. It seemed almost philosophical. Did he have to save someone who had rejected him based on the color of his skin? "Yes," Dr. Reynolds answered simply. "I did. That's my job. That's who I am." Richard closed his eyes, either from exhaustion or to process this information. Dr. Reynolds checked the monitors one more time. "Get some rest, Mr. Blackwell. I'll check on you in the morning." As Dr. Reynolds turned to leave, Richard scribbled something else on the board and tapped it weakly to get attention. Dr. Reynolds looked back. Written on the board was a single word: "Why?" It was a loaded question, one that cut to the heart of their unusual relationship, to Dr. Reynolds' choice of profession, to the oath he'd taken, to the kind of man he had chosen to be despite the world's attempts to limit him. Dr. Reynolds considered his answer carefully. "Because when I look at you, Mr. Blackwell, I don't see a white man who didn't want a black doctor. I see a human being with a heart that needed fixing. And fixing hearts is what I do." Richard's expression was unreadable as Dr. Reynolds left the room, but something had shifted in his eyes, a crack in a foundation that had seemed solid only yesterday. The next morning, Richard was stable enough to have the breathing tube removed. Dr. Reynolds performed the procedure efficiently, then checked Richard's vitals as he adjusted to breathing on his own again. "Your oxygen saturation looks good," Dr. Reynolds noted, reviewing the monitor. "How are you feeling?" Richard's voice was hoarse when he finally spoke. "Like I got hit by a truck." "That's not uncommon after what you've been through." An uncomfortable silence fell between them. Richard stared at the ceiling for a long moment before speaking again. "My father would have walked out of the hospital rather than let you treat him," he said finally, his voice low. Dr. Reynolds maintained his professional demeanor, though the statement stung. "Fortunately, you didn't have that option." "No," Richard agreed. "I didn't." Another pause. "My grandfather used to say there were certain jobs colored folks just weren't meant for. Doctor was one of them." Dr. Reynolds had heard variations of this sentiment throughout his career, sometimes stated bluntly, sometimes hidden beneath loaded questions about his qualifications or experience. He'd learned to let such comments roll off him like water, to maintain his dignity by refusing to engage with the underlying prejudice. But there was something different in Richard's tone, not defiance or continued bigotry, but something almost like wonder, as if he was quoting these views not to reinforce them, but to acknowledge their presence in his upbringing. "Your grandfather was wrong," Dr. Reynolds said simply. Richard nodded slowly. "Yeah, seems like he was wrong about a lot of things." It wasn't an apology, not exactly, but it was an acknowledgement, and in Dr. Reynolds' experience, that was often where change began. "The cardiologist will be in later to discuss your long-term recovery plan," Dr. Reynolds said, returning to medical matters. "You're looking at medication, lifestyle changes, and cardiac rehabilitation. Will you still be involved?" Richard asked, the question clearly difficult for him. "I'll be overseeing your case, yes." Dr. Reynolds paused, then added, "Unless you'd prefer another surgeon to take over now that the emergency has passed." Richard looked directly at Dr. Reynolds, really seeing him perhaps for the first time. "No," he said finally. "I think I'm in good hands." The week following Richard's surgery unfolded in a series of small but significant interactions. Each day during rounds, Dr. Reynolds would check on Richard's progress, explain test results, and adjust medications as needed. What began as tense, minimal exchanges gradually evolved into something resembling normal doctor-patient conversations. On the third day, when Dr. Reynolds explained that the ejection fraction of Richard's heart, the measurement of how efficiently it was pumping, had improved slightly, Richard asked his first question that wasn't directly about his survival. Where did you go to medical school? Dr. Reynolds looked up from the chart. Harvard. Then residency at Johns Hopkins. Richard nodded slowly. Top schools. Yes, Dr. Reynolds agreed simply, neither defensive nor boastful. He had long ago stopped feeling the need to justify his credentials to patients who questioned them. My daughter wants to be a doctor, Richard said unexpectedly. She's 17, straight-A student. Been talking about medical school since she was 12. Dr. Reynolds found himself genuinely interested. What specialty is she considering? Pediatrics, I think. She volunteers at a children's hospital on weekends. There was unmistakable pride in Richard's voice. That's excellent experience, Dr. Reynolds replied. The application process is competitive, but dedicated students with that kind of hands-on volunteer work stand out. Richard seemed to hesitate before asking, was it hard? For you? The loaded question hung in the air. They both knew what Richard was really asking. Was it hard because you're black? How much harder was your path than my daughter's will be? Dr. Reynolds considered his answer carefully. This wasn't just a casual conversation. It was a potential teaching moment for a man whose worldview was being challenged. Medical school is difficult for everyone, he began. The hours are grueling, the material is complex, and the stakes are high. But yes, there were additional challenges for me. I often felt I had to be twice as prepared, twice as confident, twice as perfect as my classmates. Richard's gaze dropped to his hands, which were fidgeting with the edge of his blanket. There were professors who seemed surprised when I knew the answers, Dr. Reynolds continued. Patients who requested different doctors without even giving me a chance. Subtle assumptions that I was there to fill a quota rather than because I earned my place. He paused, then added, but there were also mentors who saw my potential and pushed me to excel. Colleagues who became friends and allies. And patients who trusted me with their lives and were grateful for the care I provided. Richard looked up, meeting Dr. Reynolds' eyes. Like me, he said quietly. I'm grateful. It was the closest thing to an apology that had passed between them, and Dr. Reynolds accepted it with a nod. Your daughter, he said, changing the subject slightly. She'll face her own challenges. Medicine isn't an easy path for anyone. But if she's passionate and dedicated, she'll find her way. Would you? Richard began, then stopped, seemingly embarrassed by what he had been about to ask. Would I what? Dr. Reynolds prompted. Would you be willing to talk to her someday? About medical school, what to expect? The request caught Dr. Reynolds by surprise. This man, who days ago had refused treatment from him based on race, was now asking him to mentor his daughter. I'd be happy to, Dr. Reynolds said after a moment. I speak at several high schools each year about careers in medicine. I could add her school to my list. Relief and something like gratitude crossed Richard's face. Thank you. As Dr. Reynolds left the room, he reflected on how dramatically their dynamic had shifted. It wasn't a complete transformation. Generations of prejudice couldn't be erased by a single life-saving operation, but it was a start. A crack in the foundation, letting in a glimmer of light. By the time Richard was discharged 10 days after his surgery, he and Dr. Reynolds had developed a rapport that, while not quite warm, was respectful. The discharge process included a detailed plan for recovery, medication, and follow-up appointments. Remember, cardiac rehabilitation is not optional, Dr. Reynolds emphasized as he reviewed the discharge papers. 3 sessions a week for the next 12 weeks. It's crucial for rebuilding your heart strength and preventing another event. Richard nodded, taking the papers with a steadier hand than he'd had days earlier. I'll be there. My wife will make sure of it even if I try to skip. Dr. Reynolds smiled slightly at that. Good. Supportive family makes a significant difference in recovery outcomes. As a nurse arrived with a wheelchair for the hospital's standard discharge protocol, Richard extended his hand to Dr. Reynolds. Thank you, he said simply. For everything. Dr. Reynolds shook his hand, the gesture both professional and meaningful. Take care of that heart, Mr. Blackwell. He watched as Richard was wheeled away, acknowledging the complex emotions the case had stirred in him. Throughout his career, Dr. Reynolds had learned to separate the personal from the professional to provide excellent care regardless of how patients viewed him. But cases like Richard's, where prejudice gave way to something like respect, carried a particular weight. They weren't quite victories, but they were reminders of why he had chosen this path despite its additional challenges. 6 months later, Dr. Reynolds was reviewing files in his office when his assistant notified him of an unexpected visitor. "A Mr. Blackwell is here to see you. He doesn't have an appointment, but he says it's important." Curious, Dr. Reynolds agreed to the meeting. When Richard walked in, Dr. Reynolds was struck by the changes in him. The man looked healthier. He'd clearly lost weight. His color was better, and he moved with more energy. "Mr. Blackwell," Dr. Reynolds greeted him, standing to shake his hand. "This is a surprise. Your next follow-up isn't scheduled for another month." "I know," Richard said, seeming slightly nervous. "I'm not here about my health." "Well, not directly anyway." He reached into a folder he was carrying and pulled out a flyer, which he handed to Dr. Reynolds. "Heartfelt Stories, Community Health Education Series," Dr. Reynolds read aloud. "At Westside Community Center. It's a program I started," Richard explained. "After my experience, I realized how little people in my community know about heart health. Especially men. We don't talk about it, don't get checked until something happens." Dr. Reynolds was genuinely impressed. "This is excellent, Mr. Blackwell. Prevention and education can save countless lives." "That's what I'm hoping," Richard agreed. "We've got local nurses and nutritionists volunteering, but what we really need is a cardiologist to give a talk about heart disease signs and prevention." He hesitated before continuing. "I was hoping you might consider it." The invitation was unexpected but not unwelcome. "I'd be happy to participate," Dr. Reynolds said. "My schedule is quite full, but I can make time for this." Relief washed over Richard's face. "Thank you. It would mean a lot to have you there." As they discussed potential dates and topics, Dr. Reynolds realized just how significant this moment was. 6 months ago, this man had refused to let him provide medical care because of his race. Now, he was specifically requesting Dr. Reynolds to speak to his community, a community that, Dr. Reynolds suspected, might share some of the biases Richard had once held. "There's something else," Richard said when they'd settled on a date. "I've been sharing my story, our story, with the group. About how I didn't want a black doctor, and how you saved my life anyway." Dr. Reynolds kept his expression neutral, though he was surprised by this revelation. "It's made some people uncomfortable," Richard continued, "including me, telling it. But I think that's the point. It should be uncomfortable, looking at your own prejudice like that." "That's very honest of you," Dr. Reynolds observed. "Not everyone would be willing to be so open about such an experience." Richard shrugged, though the gesture belied the significance of his words. "Nearly dying gives you perspective. So does being saved by someone you've been raised to think less of." He looked directly at Dr. Reynolds. "I was wrong. About you, about a lot of things. And I'm trying to do better." The simple admission carried more weight than an elaborate apology might have. It acknowledged not just a personal failing, but a systemic one, the biases passed down through generations, rarely challenged until something forced a reckoning. "That's all any of us can do," Dr. Reynolds said. "Try to do better than we did before." As Richard stood to leave, he asked one more question. "Do you get it a lot?" "What I did?" Dr. Reynolds considered the question. "Less than I used to," he said honestly. "But yes, it happens." Richard nodded, absorbing this. "That must be exhausting." "Sometimes," Dr. Reynolds acknowledged. "But then there are cases like yours, where something changes. That makes it worthwhile." 2 weeks later, Dr. Reynolds stood at a podium in the Westside Community Center, facing a room full of people who had come to learn about heart health. Richard had introduced him with unmistakable respect, sharing abbreviated versions of both his credentials and their personal story. As Dr. Reynolds looked out at the diverse faces in the audience, he recognized the significance of the moment. Here he was, a black cardiothoracic surgeon, sharing life-saving information with a community that might previously have been skeptical of his expertise solely because of his skin color. But there was something else happening too. In the back of the room, he noticed a teenage girl watching him intently, taking notes. Richard's daughter, he presumed, the aspiring doctor. She looked at him not with suspicion or doubt, but with admiration and possibility. This, Dr. Reynolds thought, was the true healing, not just of hearts physically damaged by disease, but of minds limited by prejudice. It wasn't a perfect cure. Generations of bias couldn't be completely overcome in months or even years. But it was progress, one story, one life, one changed perspective at a time. Heart disease doesn't discriminate. Dr. Reynolds began his presentation, and neither should our approach to treating and preventing it. Today, I'm going to share information that could save your life or the life of someone you love. As he spoke, he noticed Richard nodding along, a man fundamentally changed from their first encounter. The emergency that had brought them together had been medical, but the transformation that followed was profoundly human, a reminder that sometimes healing extended far beyond the physical body to touch something deeper, something that connected us all beneath the surface. And in that community center, surrounded by people who had come to learn from him rather than doubt him, Dr. Isaiah Reynolds felt the full circle of his calling, not just to save lives in crisis, but to change them before crisis struck. Not just to be exceptional despite prejudice, but to help dismantle it through excellence and presence. It wasn't the path he had envisioned when he found that book about the heart in his elementary school library all those years ago. It was, in many ways, harder and more complex. But looking at Richard and his daughter, at the ripple effects of one life saved and one mind changed, Dr. Reynolds knew with certainty that it was exactly where he was meant to be. If this story touched your heart, make sure to like and share it with someone who needs to hear it. Have you or someone you know ever battled against prejudice? Or have you ever judged someone based solely on their appearance, only to have them prove you entirely wrong? Drop a comment below, share your story. Subscribe for more powerful stories of transformation, and hit the notification bell so you never miss a video. Thank you for watching, and see you in the next video.